Hi, today I want to talk to you about what is the best interest of the public. So any information I do disclose to the public, I have thought about very well, and I've weighed it all up, and it is definitely something that the public needs to be aware of in order to safeguard and protect the NHS. We know a few years ago, when we look back through the history of the NHS, how good it was run, the services, customer services, primary care support services, A&E, everything used to be a lot better than things are at the moment. Let's be honest, we all know that NHS is actually in a big problem at the moment. We are only told on the media, TV, newspapers, radio, that this is the current situation, this is the problem. We are facing challenges and issues, difficulties within the NHS, but not actually telling us the serious problem, how serious this really is, that the NHS is actually in very big problems right now at the moment. We know one of the causes for that was NHS has gone private in some of the parts. For example, Capita is one of them, companies who have taken over NHS. And I'm going to talk about primary care support services in Preston, County Lancashire. Since Capita has taken over, I have seen the downfall of the NHS and the actual mess that Capita has caused and done to our services within the NHS. So I want us to think about this. Take time to consider all of it, because this is to safeguard and to ensure that our NHS is run down with standards of integrity and with fairness, that we all get the same fair service from the NHS. At the end of the day, we're the ones that pay taxes, and we're the ones that we ought and deserve to get fair treatment from the NHS, all of us. So if we're paying for a service from our taxes, we are entitled to that service that we ought to have with fairness. And at the moment, I do say we do not have that fairness, that treatment, that service from the NHS, because it's run through Capita. There was shortage of staff at Preston Primary Care Services, and staff was put under extreme, yes, the word is actually extreme levels of stress to do the work that needed to be done, because Capita didn't want to employ further people to save them money, but in fact they were working out the staff to exhaustion and stress. They were running behind with the work, so there used to be very often backlog on work, such as allocations of NHS numbers, emails, national back office, adoptions, deaths, change of circumstances, everything else. There used to be a lot of backlog, and the quarter needs to be closed at the primary care services every 3 months. Now, before the end of every quarter, all the backlog needed to be finished and clear, because if it wasn't, the consequences of that would be that NHS staff would not get paid, opticians would not get paid, basically doctors, nurses, cleaners, everybody working within the NHS services would not get paid. So serious consequences of that. So you can just think for a moment the levels of stress the staff at Preston Primary Care Support Services were going through. They were having to work Saturdays, overtime. They were asked to go even on Sundays. Capita was giving them bonuses money as extra to bribe the staff to go in, because this is how bad the backlog was, and all that was failure of Capita's ability to deal with this situation. All they needed to do is employ extra staff, but they did take some agency staff, but then they need training as well. So the staff who already knew to do the work, they ended up having to train the temporary staff from the agency. So then they were running behind with the work again, because instead of doing with that work, they were putting the time in training that new staff from the agency. And you may recall, many of you people, when you rang primary care support services over the telephone, that there was a point when it was extremely difficult to get through on the telephone, and then you probably was told that we're extremely busy and we get lots of phone calls, because this is what staff was actually told by the managers to do, to basically lie to people that we're sorry, but we do get lots of phone calls. Yes, the truth was we were getting a lot of phone calls, but what really happened was Capita decided to unplug many telephone lines from the sockets, because they were constantly ringing. So they would leave only 3 telephones plugged in every day, and sometimes less than 3. So you can imagine 3 telephones, everybody's trying to get through to primary care services, and it was constantly busy, and you were lied to, basically to say, we're sorry, but we are getting lots of calls, when in fact the reason you couldn't get through was because the lines were so full and overloaded. Why? Because the telephone lines, most of them were unplugged and only 3 left in, and there were a lot of telephones in the office. It was a big office, so it gives you an idea how many telephones there were unplugged. For example, on one desk there were 2, 4, about 5 or 6 people on one row, and then facing your row, it was another row. So we had about 1, 2, 3, 4, 5, 6, about 6 of these double desks with staff, and each person had a telephone, and usually we share extension numbers with someone else, but it just gives you an idea how many telephones were unplugged by Capita's decision. And then one manager came to the staff and say, if people ask you what's going on, tell them we're sorry, but you're getting a lot of phone calls, and that's it. Also, because of the backlog, GPs, NHS staff, patients. They were calling primary care services in Preston to complain. Why have they not received the medical records, for example? Why has National Back Office not been dealt with the query? There were deaths that needed to be removed, or anything else. So basically they were told, we're sorry, we're extremely busy, but we will deal with it as soon as we get to it. But the bottom line was, when this manager came to the staff and say, basically lie, staff was not happy because they said, I'm not gonna lie to people, I can't lie. So yeah, staff was not happy with it, but may I just say that this manager is not her fault, because she was only telling staff to do what the higher person above her told her to tell us. So she was telling us what she was taught to tell us. She was just delivering the message to people. Another unacceptable, and I think this is totally gross, because when we moved GPs, we transferred all our medical records to the new GP. If I just want to make a point on this, many of you, or some of you, to some extent, might have rang primary care support services and complained, or that you were not happy because why your medical records have not arrived after weeks and weeks. Well, I'll tell you why. Sometimes, I'm not saying every time, but sometimes medical records have gone missing, have been lost during the transport from Preston office to the other office where they should have been. So obviously they completely gone missing. So that's another reason why some of you did not get your medical records on time, but you were lied to again. May I just say that it's not the staff's fault for trying to give you an answer, because the staff is afraid. The staff obviously will not speak because they need the job. If they speak against this, they get the sack for it. So that's the consequences. So the whole fault is Capita's, basically, to all of this mess. What can I say? We need people in the NHS who are willing, who are loyal, passionate, and most of all with integrity, to fight for the NHS, to build it up, not to not give a word on it, or not a bit of value on the NHS. Because if we have such people in the NHS, ruling the NHS, representing the NHS and taking the lead, then we can only expect more downfall of the NHS services. This can only happen, as I said, if there are people within NHS who have integrity, not to be deceitful to us, but to give us the service that we actually need, which I'm paying for a service. If I'm paying for a service, for example, or I'm taxed till my death, even if I wasn't paying for the NHS or anything, or any taxes, you still expect a service. And the NHS used to be a name to be proud of. Staff used to be so proud, carrying the NHS badge, knowing that they have a job within such an honourable position. But nowadays, a lot, I mean, all the staff at Preston primary care services are sick to death about what's going on. They're not happy, you know, but what can they do? They need a job and they're not gonna speak about it. I mean, NHS, from my belief, from my belief, from what I know, NHS already knows the situation about what Capita's done to this, but yet continues to allow Capita to run the NHS primary care services. Well, this in itself speaks volumes. I mean, NHS at the moment, I think they're worried that if they get rid of Capita, usually that's what it should have been. If Capita didn't keep to the contract which they signed with the NHS, they could have been terminated. But the damage, it's so bad to the primary care services now that anyone who would take it decide, you know, is going to find it extremely difficult to get it back on track. And this is really serious, and it's more serious than it's even looking or sounds, you know. Used to have primary care services, they used to have this system called the Nexus on the computer, and you would get allocated a certain amount of work on that day, and you had to finish it within that day. Basically, you had to work really fast, and that was putting a lot of pressure on you, because and stress, anxiety, because if you didn't finish it by then, let's say for example you get allocated to do 400 NHS numbers to allocate someone NHS numbers, and they give you a period of time how long the system how long it'll take you to do it. But what's happened was they've put the figures in that takes less time to do it than it does in reality, and that left you, the staff, really extremely stressed, because that could risk you losing your job. If your Nexus record kept showing that you've not finished your 7.5 hours and that you only done work, let's say, for 4 or 5 hours, but when in fact you worked all day in front of that computer. So that just gives you an idea of how Capita works and how they deal with staff, how they, for example, if you do get an unfair dismissal from work or the sack, and you ask them, if you was to ask them for the access information, any information they might have on you, they have 30 days by law to provide you that information. Any information they hold about you, they're obliged to give it to you within 30 days. But they don't give it to you. So then what you need to do is you have to put your time, your stress right into them, then having to log a complaint to the independent access department, you know, where you can actually make a complaint, and then you have to go through all the routes if you want to log complaints to Ombudsman or wherever it is necessary. but they don't make it easy for you. And guess what? You're entitled to that information without you having to keep writing and asking over and over again about your information, about reason why you have been dismissed, which by law that you're entitled to have. So that's another way of Capita, let's call it this way. What can I say? You know, the situation really is bad, you know. What else more is to say? You know, Capita continues to wreck the NHS, and if NHS is aware of that but still continues to keep Capita, then just expect that it will only get worse. You know, they got rid of a lot of people, left still, they leave that place because they're not happy. People who worked there for donkey's years, for years and years, have experience there, you know, and they're sick to death about the way that Capita is going on about things. So if experienced staff in higher places in that office are living, who've been there for a long time, that should show how serious the problem is, you know. So next time you ring primary care support services and they try to give you the classic side step or to take you around the blocks that about why telephones aren't being picked up when in fact they have been unplugged, about why your medical records haven't arrived, about why so many important emails have not been dealt with, about why so many changes, deaths, communications, everything. Basically it's a fail because staff shortage and deceit. There's a lot of deceit going on, you know. I care about NHS, and I hope me doing this video will give people an idea of how serious the situation is, and if we continue to accept the NHS to be privatized, then there will be serious consequences. And the primary care services in Preston it's a true example of how bad things will get if NHS will go private. So what are we to do about it? Really, we can't just stand or sit and do nothing, you know. If we care about the NHS, we will speak out, we will fight, we will take steps to protect it. I mean, an investigation, for example, anyone, or for the media or for the NHS, I'm talking about, anyone can talk to staff at primary care services in Preston, but in confidentiality, on one-to-one. I believe that people will tell you how bad the situation really is and confirm to you what I just stated all here is actually fact, not an opinion, not a belief, but it is a fact. And if you were to speak to any of that staff there in confidentiality on one-to-one, they will tell you, because they themselves, you know, they're stressed out and about how everything is going on. So if by any means do your investigation, do you speak to any staff or speak to any staff, not just at Preston, but also at other offices that have been made private and took by Capita or any other companies, and see how bad the situation really is, because it is much worse than it is portrayed on the media. You have to be inside to really see how serious it is. Other than that, you won't know. But I tell you why, if this continues, NHS will no longer have an NHS, and patients will be frustrated and angry. Staff, the NHS, you know, they will just have enough of it as well, and the only thing is to nip it in the bud and deal with it before it's beyond repairable, because at the moment the future of NHS in the hands of Capita is very, very damning, and I hope and I trust it will not get there.